So, welcome to ACNR's Neurovoices podcast. I'm Rachael Hansford. I'm the publisher of ACNR, and I'm joined by Amy Ross-Russell and Rhian Raftopoulos.
Thank you.
We want to discuss an article that you very kindly wrote for ACNR back in 2020 about your experiences as trainees of working less than full time. And so it seemed like a great time to, now that you're both consultants, to go back and talk about your experiences and the benefit of hindsight. So maybe first of all, I could ask you to introduce yourselves properly and tell us what you're doing now.
Thanks very much for the invitation to come. I'm Amy Ross-Russell. I'm a consultant neurologist in Southampton and at Queen Square. And I am, excited to talk about the opportunities and to promote less than full-time working and to encourage flexible working and working around individuals' needs.
I'm Dr. Rhian Raftopoulos. I am a neurology consultant with a specialist interest in neuroinflammatory disorders. I work at King's College Hospital. I work less than full time and have done so since 2017. And again, a big fan of promoting less than full time working and helping people to do that.
Actually, that's something I hadn't thought to ask, is whether you are both still working less than full time. So you are both still working less than full time?
Yeah, a little less full time perhaps than I was at the time before.
Yeah.
More full time, but still less than full time.
Okay. So rereading your article earlier, it said that in 2018, there were 27% of consultant neurologists working less than full time and 12% of trainees. I was impressed that there were so many. Do you think that's changed in the last 5 years?
I tried to Google it before we started to see if there was any up-to-date data. So I think those numbers came from the ABM workforce, which was
That's right, yeah.
2020. And from discussion at the time, I think there's the potential for them to be slightly misleading because, of course, the less than full time takes into account people who have retired and come back working less than full time as well. So it's a slightly mixed bag, I think. But I'd be very surprised if those numbers haven't gone up. Certainly the trends nationally amongst trainee doctors and I believe also consultants for less than full time working has gone up. Anecdotally, I've seen an increasing number of people with more flexible schedules, whether that's full time or whether that's about working in different ways and working flexibly in different hours. But certainly my expectations for job flexibility are different now amongst colleagues writing their consultant job plans to what they would have been as a trainee.
No, I agree. I think almost certainly that the numbers of less than full-time consultants and trainees will have gone up. Like I saw some data from the RCP that 1 in 3 consultant positions are now working less than full-time, and nearly 50% of women consultant positions that are working less than full-time. I don't have up-to-date data on neurology, but I think almost certainly there is a trend, and I think that will continue.
Well, isn't it what you mean by less than full time? Because it's all PAs when you're a consultant.
Yeah.
And you're paid for your PAs. You're not paid for 3 days a week or scheduled numbers of hours in the hospital per week. You're paid for the responsibilities and the estimated time that occupies, and increasingly on an annualized basis. Many people who would do a 12 PA job over 5 days a week, whether that incorporates on calls. And there are some people who spend 2 days a week in a hospital but have a 6, 7, 8 PA job plan, and it's calculated on the number of hours and the number of out of hours commitments that they have.
That what you mentioned earlier about the number of women, actually, that was something that's quite interesting, is to know whether this part-time working is driven largely by women. You said 50%, so is it equal then?
So as in 50% of women consultants.
Okay.
I think there would be significantly less male consultants working less than full time. And as Amy says, I think a lot of the male consultants working less than full time will be over 60, retirement age, and maybe retired and returned. So that is a slightly different cohort of people. Yeah.
Looking back at the article with, in the rearview mirror, as it were, when you first decided to work less than full time, what expectations did you have about that? How did that look in your heads?
So I suppose that the reason for going less than full time is to get this utopia of a work-life balance. So yeah, I guess I wanted to spend quality time with my son at the time. That was my first child, but also continue to progress my career and have a fulfilling career. So it was to try and have it all, I suppose.
I think that's the reason that certainly anecdotally, the majority of people who I know who have gone for less than full time has been on their return from their first maternity leave. I think that's still the norm, particularly amongst trainees, and allowing for some decisions that are based on health or based on other commitments. But people that I know have made that decision on the basis of seeing their particularly preschool children, and life changes quite a lot in that scenario, and I think it's quite expected. People will have that conversation with you, so I think even in advance of my first maternity leave, my TPD was very proactive in saying, do you think you're likely to come back less than full time? Or do you think that there's a possibility that you'll come back less than full time? Because they've got to think about that ahead of time. And so there's a sort of expectation that you'll at least be thinking about it and considering that option, which I think is great. I think, it's fantastic that option is available to us. And I think we're really lucky in medicine that by and large in a training program, and I don't have experience other than my own, but I haven't heard tales of people being refused to come back less than full time in medical training. I think we're pretty well protected from that possibility, and there's a fairly well-worn path of that happening.
I'd agree that the expectation, I think, is after maternity leave that lots of women will want to return less than full time, and there's not much resistance to that. In my experience.
And in your article originally, you talked about the 2 reasons that you could give for wanting to work less than full time. And at that time, there was a mention that it might be changing so that you didn't need to give a reason.
Yeah, that's changed now. So there's the category 3. You just have to have a well-founded reason. So anyone can apply for less than full-time training now. So yeah, it's definitely opened it up. And I think that's in response to trainees in particular wanting more flexible working.
And you also mentioned about the champions of flexible working that were to be in every trust or hospital. Is that happened?
Yes, I've not had to use it, but again, I double checked before I came, and still very much a thing.
Looking back on your experiences as a less than full-time trainee when you were training, what were the biggest surprises or challenges? I know you wrote about some of them in your article at the time. I mean, you may want to reiterate those, or there might be something that's occurred to you since.
So I think there are some hard things about working less than full time, and I think they change a little as you go through, and there's some that are more challenging at certain times than others. But I'd say consistently, things that I have found difficult have been switching off and segregating the 2 halves of your life, because they will naturally spill into each other. You can't prevent days where your children are sick, and that's going to have an impact on your work. You can't affect, if you're worried about your children, taking that with you to a certain extent to work. And likewise, there may be unwell patients or things that you're worried about, or scenarios that have been difficult to manage at work, or that you've become very invested in the management of a particular patient, and they will overspill. The more obvious way that happens, and one of the particular challenges I was like, more recently as a consultant, is the email burden that you have. So back when we were trainees, we had a number of emails, but we weren't as directly responsible for the contents of those necessarily. And even I think over the last 5 years, there's been a huge increase in the amount of management, decision, planning, logistics that is done via email. And so I think perhaps one of the things to think about if you're thinking about less than full-time training, or one of the things that you have to work out yourself, is what your way of managing that is, what your balance is. Do you want to have your emails coming to your phone from work when you're at home? Do you want to have an out of office that says your working days? How rigidly do you want to stick to that? Do you occasionally want to dip in and be helpful? If you do that, how do you communicate when you're pulling back out again, so that your responsibilities in and out, and making your responsibilities clear? And I think all of us feel our responsibilities both at home and at work very acutely. We care about doing our job well. We care about looking after our children and spending quality time with them. And as I think we said in the article at the time, those 2 things can spill into each other, and working out how strict you want those lines to be, how you want to carve that time out, how you want to model that blend and how much you're happy for those things to coexist is an important thing to think about. And I think one of the really big challenges of doing it well without ending up stressed or worried that you're not doing either one as well as you could be.
I completely agree with that. I think it is harder in some ways as a consultant to have those firm boundaries, because obviously as a trainee you're often job sharing, so there is somebody there when you're not there. As a consultant, obviously you're responsible for your patients. There isn't necessarily somebody there when you're there, and you have other responsibilities. You're teaching medical student management responsibilities, all of those things. So those boundaries can be harder to put up, I think, than whilst in training. And I remember in training, one of the things I found difficult was feeling that I wasn't doing either thing particularly well. I'm sure lots of people will feel this, that when you're at home, you're thinking about the patient who was unwell that you saw yesterday and wishing you could follow up. And then when you're at work, you're worrying about your young child at nursery and how they're getting on. So yeah, it's that constant push-pull. You never feel quite like you're doing as good a job in either thing as you'd like to. So that was a big challenge. And the other thing I found more so as a trainee, because as Amy says, as a consultant, you have your set PAs and you know exactly what you're doing. The job is tailored to you in a way. But as a trainee, you're often having to deal with rotas and rota managers. And I spend a lot of time, particularly when I started less full-time training, not all rota coordinators understood less full-time rota management. And so I'd spend a lot of time trying to change things. And also every time I would move to another hospital, my pay would invariably be wrong. So there was a lot of that kind of admin around it that you can do without. But yeah, those were the main challenges for me.
And how well do you think that working less than full time did actually help you balance work and home life in reality then?
I think it definitely helped. I mean, perhaps not quite as much as I'd hoped. And I think, all doctors that work less than full time will tell you that you always end up working more than your allocated days and allocated hours. But, certainly it did allow me, me and my family some breathing space. I did get to spend quality time with my kids, and that's a spillover that can happen into the weekend when you're working full time. That didn't happen. So the weekends was very much for me and my family, which really helped. So, I mean, there's never going to be a perfect system. We work in the NHS, but yeah.
I think it protects some time, doesn't it? And sometimes the theory of doing it is as helpful as the practice of the time that you're there. And knowing that you have allocated time that is there to be at home, you're not in the building, you're not going to be asked to do stuff, alleviates some of that concern because you know that you've got that time. I think there's just challenges that come with it. You can't be 100% at either one all the time. And that's a real challenge. It's really difficult because you want to be everything to everyone all the time. And so I think there's a bit of reality checking and making sure, but yeah, definitely it's given me more time with my young children. And my youngest is approaching school age now. And I really look at how my life's going to change. And I'm really grateful for being able to have that time, because not everyone's able to. Their jobs don't allow it, their finances don't allow it, their partners' jobs and responsibilities don't allow it. And I think we've been incredibly lucky in medicine to have that possibility with the setup. I feel really lucky to have been able to have that time. It's not been easy always, but it's been a real blessing.
Yeah, I'd be interested, Amy, in how much of that is sort of specialty specific as well. Obviously in neurology, we're quite lucky. I have friends who are surgeons where it's maybe a bit more difficult. Obviously pediatrics and GP has traditionally been very female and traditionally.
Yeah, I think neurology's had a real shift, hasn't it? From a fairly male predominant to a much more female predominant. I think we're slightly over 50% now, maybe even 60-40. I think that was the sort of numbers in the ABM workforce again, but I couldn't quote you chapter and verse. But yeah, I've found it really very flexible amongst the people that I've known. I think sessional stuff can go one of two ways. I've got friends who are doing anaesthetics who have found balancing the rota incredibly difficult.
Yeah.
But actually, once the logistics are done, it's been pretty supportive because it's a sessional environment. And I think, like you say, with your consultant template being building blocked together, I've definitely noticed that it's you stand out less as a consultant when you're less than full time. And that's a little bit because there's probably more of you that do it. And certainly where I work, there's quite a lot of people who are less than full time or who are split between sites. So there's a lot of folk working in neurology. So it complements quite well because nobody's in the centre every single day, or very few people are in the centre every single day. But yeah, I agree. I suspect there is a difference. And I suspect there's a difference in different parts of the country as well, you know, to do with the setup and the way that things are orientated, the way that training programs are designed. It's incredible, really, that it is achieved successfully, I think, in the majority of cases, because it's a real challenge to line up training programs, working days with people's childcare commitments, when their training finishes and tying that in with new jobs and making your job shares work. It's a real challenge.
That leads nicely also into the next bit, which is a bit more personal. You're the women in the family and you're working less than full time and looking after your children. So the questions then are about the role that your partner played in all of this. And I know, Amy, that your husband is a doctor as well. What role did your partner have in making less than full time working work for you?
My husband's an ophthalmologist. He was, I think, a couple of years shy of finishing when we had our first baby, and then was a consultant with the second. And the transformation as a wife doing maternity leave from him being a surgical trainee and a consultant was unrecognizable. That was life-changing. And that control of your own time, flexibility, reliability, that made it completely different from being the one at home, particularly on maternity leave. So we discussed whether we would both go less than full time. I feel like we're a generation where things have shifted a bit. I don't know whether that's true, but I feel like more men are working less than full time, taking bits of shared parental leave, and there's a slightly more open conversation about it. And we did talk about friends of ours do 80% each, and I really like that as a model. I think that's a really nice model if you can make it work. It wasn't what we chose to do. I think I chose to have the 2 days that I felt I could, and there wasn't anything he wanted to drop from his job plan, and he enjoyed working full time. I felt lucky to get it, and so I didn't make it an argument.
I guess my situation was different just because my partner was non-medical, so that does make things, I have to say, a lot easier. It had much more flexibility in his job. And I think in any partnership where you have children, it's about teamwork, isn't it? And on the days that I wasn't working, I would take over the childcare burden. And then on the days that I was working, he would pick up the childcare baton, if you like. And it would allow me to, perhaps sometimes I'd need to stay late. So that made it a bit easier, I have to say. And I always am in awe of people who have two doctors. Lots of my friends are two doctors managing childcare because it is a logistical nightmare. So yeah, respect.
We have a semi-formal rota of a sort of hierarchy of if you get the call of a temperature or vomiting, of on-call, outranks surgery, outranks clinic, outranks admin.
Yeah, I can imagine. I don't know how you guys do it. I mean, it is a logistical nightmare, and just managing the rotas is very difficult. But I was lucky I didn't have to juggle that.
I think one thing that's really important, particularly if there is a juggle, is getting good, reliable childcare. So I listened to a podcast about, I think, working mums. I can't remember if it was limited to medics or not. I think it was. But the one sort of piece of advice that comes up time and again is get good childcare. Spend your money on good childcare. If you're going to invest in your career and go back to work, spend money on feeling safe, because I've had one time when I had to rush home and I was seeing a complicated patient who I really wanted to give good time to. And that is a really uncomfortable feeling. And, it's just not a job where you can clock watch, where you need to be somewhere. And you have to have people you can trust, know that your childcare is safe, and know that you can be at work when you're at work.
Yeah, That's key. That's key. In my case, that was my partner. But yeah.
My job is different, obviously, much more flexible, but I've got family around me. I'm surrounded by parents and siblings and people that are really good friends that help me. So, but I was really surprised that children get sick. I thought, oh, you have a child, you organise childcare, and then that's your plan in place. Yeah, so the children being ill, and what do you mean you can't go to the childminder because you're sick? But it was a real well, what do I do now? I can't imagine if I was a doctor and I was with patients and I got that call, what that must feel like.
Yeah, I mean, in reality, you're rarely in the absolute midst of acute emergency care at a time when you need to go and you need to finish for the day. But you have to be wary to the fact that there are times when you're going to have to look at that, and there are times when you have to divide that responsibility in order to prevent you being in the scenario where you can't pick up your children or you have to leave something in the middle of it. And that's a combination of robust handover, good colleagues, and good childcare.
Good childcare. It's a top tip, really, isn't it?
Yeah. Yeah. Always have a backup plan.
So actually, what we talked about, the increase in less than full-time working, and you mentioned that some men are now, and maybe more the retired ones, but more people are working less than full-time. So that maybe has affected attitudes and perceptions at work to people who work less than full-time. So how did you find that your colleagues reacted to your decision when you were training? And is there any difference now in the way that people react to you?
Yeah, I mean, I think Amy covered it earlier on in terms of, actually, I think it is much more expected these days. You know, you say that you're pregnant, you're going off on maternity leave, and then there's that discussion with the training program director. Okay, are you coming back full time? Are you coming back part time? So I think there has been quite a significant cultural shift in terms of it is now expected, and I don't think there was any significant barriers to me doing it. I don't think anyone particularly judged me. But if anything, actually, I've had it the other way, where I've wanted to increase my working hours. And I've had more senior colleagues say, but you've got a young family, are you going to be able to cope with it? And I know for a fact they haven't said that to my male colleagues with young families. So it can work both ways.
Mm.
It can be a bit of a minefield for people, I think, saying the right thing, because they don't want to imply that you're not working hard, and they don't want to imply that you're not dedicated to your job, and they don't want to imply that you're not also dedicated to your family. And I have felt for colleagues who just haven't quite realised why what they've said has potentially been really the wrong thing to hear at that time. But I feel very lucky, actually, with my colleagues. I think Pedson's a really supportive working environment, and I think there's a real understanding of less than full-time working. I think sometimes you feel a bit of an imposter, and it just comes back to that trying to be two different identities. I think identity is so important for all of us, and you spend a year, many of us, on maternity leave, absorbing and becoming that, your mum. And if they nursery phone, hi, is that, Ben's mum? And then you go into work and you are Dr. So-and-so. And sometimes I don't know, maybe it comes from us that we feel like we're viewed as less of a doctor, or we're viewed as less of a professional because we have an additional thing. And maybe people sometimes wonder, oh, you're talking to me about my children, why aren't you talking to me about my work? But you could equally think, oh, why are you talking to me about my work and not my I think it's really difficult. I don't think there's a right way of doing it, but I haven't felt discriminated against for being a less than full-time trainee. I haven't felt like my career has been disadvantaged, or the opportunities I've been given have been disadvantaged. You just have to be a bit more organised, and you have to be clear about what you're able to do. But I think when we're wondering how we're perceived, we have to also think about how we're thinking about it, and wonder how much of that is coming from our own insecurity. For me, I think sometimes that comes from my own insecurities rather than anything that somebody has said to me.
Yeah, 100%. I agree with that. You put a lot of pressure on yourself not to be seen as a part-timer, and not to be seen as not fully committed. But that definitely comes from me rather than other colleagues. And
It's the constant imposter syndrome.
Yeah, isn't it? It is. And nobody's ever said that to me or even implied it. So
you should have maybe invited a younger man. Do you know any younger men that are working less than full time?
Yeah, I've got a colleague who went to 80%, who I was really impressed by, actually. He did it for quality of life. It wasn't entirely childcare. It was in part driven by having childcare for their then preschool child, but actually at times of that year, their child had nursery placement during the day and he made a choice. He decided that he didn't work Thursdays. I think it's slightly different working 80% to working 60% because you end up more in a sort of job split 50-50. With 80%, people sort of see you as full time, and you sort of are because one day off is easy to ignore. I've also got a friend who took shared parental leave and did 50% of the maternity leave time. And both of those have done it in a very no-nonsense way, and nobody's made their life difficult in any way. But it's a lot less common. I don't have many male colleagues who...
Yeah, same. I mean, I had a male colleague as a trainee, which I think is possibly even rarer, actually, who was 80% for childcare reasons. And I didn't explicitly have the conversation as to whether he was having a different experience to me. I mean, I suspect there are slightly different attitudes to men going less than full time than women, but it's certainly not as common. And yeah, I think we've still got a long way to go in terms of more men taking up less than full time working.
So has your perspective on working less than full time changed at all, would you say? I mean, you both sound really positive about the experience and about your roles now. So it's met your expectations, clearly. Otherwise, you wouldn't still be doing it, would you?
I think there's slightly different challenges. I think there's some easier stuff as a consultant. Like I said before, very few people are around all the time. So people say, which days are you in the centre? It doesn't mean which days are you off at home. It means which days are you in the centre. And you say that to someone who works in a different centre and what's your split? When are you around?
Yeah.
They're not doing it to check up on you. They're doing it to find out when you can be helpful to them. As a consultant, you've got your PPC, your admin staff, you've got the nurses that are in outpatients when you're there, and you've got your patients. And for now, they're your patients, and that's stable and consistent. And your responsibilities are connected to your patients, not to the ward or whichever particular consultant you're attached to. So your time is your own, and that is just so much better for making your job plan flexible. I think the responsibility, like Rhian said before, the responsibility is harder. And I find, particularly with the more acute stuff, having inpatients and then being away makes your holidays a bit harder. But so now I work Monday, Wednesday, Friday, whereas before I worked Wednesday, Thursday, Friday in a block. And initially as a trainee, I really liked that. I later switched to a Monday, Tuesday, Friday setup, and then I really liked that and looked back and thought, oh gosh, I think this is much better now. Now I work Monday, Wednesday, Friday, and that's good for the responsibility and the being away from the centre with responsibility aspect, because most things can wait for a day. But if you had to leave them for 2 or 3 days, it would be more uncomfortable.
Now, that's interesting because you did say in the article about the different ways that people would work and that some people like the block. Do you think that's related to whether you're a consultant or a trainee, whether that pattern of working changed?
Not really. I think it's just individual circumstances. I mean, I can see how the block works a little better from a trainee perspective. Certainly from my experience, I like spreading out as a consultant so you're there. And that's probably more relevant if you've got more inpatient, more acute stuff, but also for feeling part of the team and being reliable and being helpful to other people and helpful to the registrar who are learning, who are looking to you for guidance on clinical scenarios or looking, to be involved in that wider team. But I think it's just really individual. I think it's something really important to think about, particularly if you're approaching less than full time, is which days of the week work, whether that's for opportunities, whether that's for the things that you want to get involved with, the services that are running. And I've rejigged my job plan to fit around one MDT, and it's been a bit of a nightmare with childcare, but now it's done. I'm delighted. But I think it's something to really think about how you want to work. Do you want to always have a day off in between your working days? Do you want to get your head down and get involved and think about those things and be there for a period of time? And I think that's going to change a lot dependent on people's job plans and what they're doing.
Yeah, agree. I work 8 PAs, so I do four days a week. So yeah, I think there is, as Amy says, there is a difference, working 3 days to working 4 days a week, and you only ever got 1 day where you're not there. But equally, you can sometimes feel like you're working full time, but just for less money. So it's got its cons as well. But for me, as a consultant, that worked better for me. And I was happy to increase up. I think you do have more control as a consultant, you've got more control over your timetable. And so it is easier from that respect, yeah.
There is a danger that you just work full time, just in less hours for less money, as you say. but it doesn't sound like you're saying that really is an issue in your roles.
It's difficult, isn't it? I think you definitely work more than your hours, but I think it's not being expected to, to be anywhere on that particular day. But certainly things do quite frequently spill into my normal working days, more so probably as a consultant than they did as a trainee. And as I say, it's slightly different because I had a job share partner who I could hand over things to, and she'd be looking after the inpatients when I wasn't there.
I think your
It's like,
responsibility is a little more rigid as a consultant. You've got your clinic patients, you've got your clinical responsibilities, and then it's admin. And I think our work can always fill more hours than are allocated to it, and often will. And there's a risk when you have that extra time to then spread into that extra time. And again, that's going to be a bit of a personal choice. There are some people who are incredibly dedicated and very conscientious and will use huge amounts of their spare time doing it, whether they're full-time or less than full-time. And there are others who are rigidly efficient and adhere to the allocated time that's there in order to keep things within. And again, I think it's about setting your limits, isn't it? And deciding what is appropriate. I don't think there's a right answer. I think there are personalities that line up with one way or the other, perhaps. But yeah, I think it's a little bit easier as a consultant to limit that I work full time in less time, because you will have less clinics and you won't have the on-demand stuff. You don't have the on-calls, or you don't have the ward, the sort of endless responsibility, acute medicine, inpatient roles in the same way. So I think your role is a little more defined, or your patient list has to be smaller.
So, advice for current less than full-time trainees. If you could go back and give your trainee self one piece of advice, what would it be?
I think I would say don't worry about doing things in your own way. Sometimes, as medics, we're very, competitive, and we have these very structured sort of training pathways, and there can be pressure to finish training within a certain time, or, do things in a certain way. And it doesn't always allow for individuality, I think. But what I would say is actually probably it doesn't matter if you spend a bit longer in training, because, you'll gain benefits in other ways. And I think in your career, as in life, things ebb and flow. So at some points during your career, you're more focused on your family, and then in other points you're more career focused. And it's just to relax into that and to not stress too much about what you should be doing.
Yeah, I think that's very wise. Enjoy the journey. I think I think most people look back at these sorts of years and just say, be a bit kinder to yourself. You're trying to be so efficient to maximize every minute so that you've got quality time at home and you've got good quality time at work. And I think building in something that I consciously trying to do now is sort of build in just a bit of spare time, and make sure you've got the capacity to do those things, but also recognize that sometimes you're just going to need a bit of extra time. And that might be admin catch up. It might be giving yourself the opportunity to sit down and read the paper that you really wanted to read, but you didn't have time because you got caught up in something. Or it might be, actually, I'm on top of all of this and I need some time to myself, or this is all a bit overwhelming, or I haven't seen my job share partner for 6 months because we're ships in the night, and actually it's really important that we have a relationship and we need to just sit down together and talk to each other. But sort of a bit of slack. I think it's really tempted to try and be so rigidly efficient that there's no spare time. And I think you're really lucky in training that you've got flexibility, you've got time to do things, you've got protected teaching time, and building in a bit of just spare time to be kind to what you need. And I guess the other thing is, particularly for trainees, is remembering that your training is about you. And it ties in a lot with what Rhian said, is it's that journey. You don't need to do it in the same way as other people, but what you do need to do as a trainee is recognize what you need. And that's going to change at different times in your training. It's going to change at different times in your life. And what you're receptive to and what you can work on is going to be different at different stages. But partly in with that spare time, and partly in combination with your TPD and your educational supervisor, but work out what you need from that year of training and what you need as a person and as a doctor and as a trainee, and work out how you can make that fit in the training that you have so that it's useful and good, and so that you're not just coming in to do the hours that you signed up for before you go to the nursery pickup. Before, be kind to yourself and work out what you're doing it for, and use that time. Rhian put this really nicely in the original article, which is about knowing your rules and knowing your rights. If you want to do it, but know what you want and have a think about what you want. Know the rules. And if the rules aren't going well for you, know the person to talk to, so that it's not a fight. It doesn't need to be a fight. It's just people aren't always well informed on what things are, and they'll usually make it work for you. If they're really not making it work for you, know who you should talk to, and know what's not right about the way things are done. And the other thing is have friends. So talk to your friends who are doing it. Have friends who are less than full-time. Have friends who are full-time, because I'm sure they'll be helpful to you at the one time that you've forgotten to request one blood test on an inpatient that you need. And I'm sure you'll have the opportunity to repay that favour. But also that it's really wonderful to have friends who understand the challenges you're going through. And I've had a particularly good friendship with one of my senior colleagues who had been through it all 5-6 years ahead of me, but just provided a real wealth of support. And sometimes that slightly longer view of, I see where you are now and you're doing fine, but I get that it's hard. And they can sort of help you focus, and friends who are going along the same time, because sometimes you just need to have a moan.
Yeah, yeah, very important. I mean, I always say to my trainees that it's important to be organised, to be proactive, but flexible and collaborative as well. And I think that's how I approached less than full-time working. And I think that's a good way to approach it if you want a positive experience.
That sounds like a great wrap-up advice. But actually, so I've got a couple of final questions then, if I'll take well, I think I know the answer to this one. Would you make the same decision about working less than full-time again?
100%.
Yeah, 100%.
No hesitation, 100%.
Can't get a better endorsement than that, can you, really? And then actually you touched on mentoring there, Amy. And so has it changed? Has your experience influenced how you work as consultants and how you mentor other people?
I'm quite new as a consultant, so I'm learning how to mentor and how to do it. But I think it's definitely given me a perspective on other people. But that's not just about less than full time. I think to mentor anyone, to be a good supervisor, you've got to look at their situation. And the thing that I have definitely realised through spending a bit more time going through training, through working with the ABNT and the ABN, and getting a slightly wider view perhaps, is people's circumstances vary a lot. In this particular context, we're talking about less than full-time training, and yes, absolutely, it's changed my approach to that. But even within less than full-time training, the reasons that people have for doing that can be very varied. Their motivation, their attitude to it, and it's not up to me to say which one is right. There isn't a right answer. There are different reasons. There are different choices that you make within that, and it's not easy. And I think understanding that a little better will help me to protect trainees who are both full-time and less than full-time.
Yeah, I think ultimately we're people as well as doctors, aren't we? And we've got home lives and families and stuff going on at home like everyone else. And it's important that doctors are allowed to experience that as well as working very hard. And so, yeah, this is why I'm such an advocate for less than full-time working. I think it allows longevity in some way. I certainly am much more enthusiastic about my job as a result of being less than full-time, prevents burnout, all of those things. So I think it makes me more understanding about the reasons people may want to work less than full-time. And I could see, in the future that it may be something that the majority of doctors do. I could see that may be the way it's going. Who knows?
The RCP published something in the last couple of years about sort of people's choices for consultant job, and about 60%. So, bear in mind, about 20 to maybe 30% of trainees are less than full time. About 60% of them say they want to work less than full time as a consultant. So looking forward, people are seeing this as the model. And I think medical careers are getting more flexible. and need to get more flexible, so that this is just, doesn't need to be the subject of a podcast. It's just accepted.
We've done ourselves out of a job in effect then, haven't we?
It's all right. We'll find something else to talk.
No, that's great. I mean, that's what we're all striving for, isn't it? So, like you say, not to be burnt out, for everybody to enjoy their job and bring their enthusiasm and their passion to it. And if we can relay to people that it's possible to do it, and they've got two shining examples in you. So that's great. Thank you for joining us.
I think the only one thing that I thought it might be helpful, but it's just to sort of point out that this is our perspective and our experience, and not in any way us telling other people how they should feel or what they should do. People have individual choices for whether they work less than full-time or full-time for a variety of reasons. And there's no right answer as to how you do it, whether you've got healthcare conditions, responsibilities, children, or it's a quality of life decision. It's an individual decision, and there's no right way to go through your training. But we are both enthusiastic about there being the time, and for people who want to do it, that is championed, and that their training is not jeopardized in any way as a result.
Thanks for listening. Please come and join us in our online community, where you can discuss this and any other neuro topics with your peers. You'll find us at forums.acnr.co.uk. Hopefully we'll see you there.